I just want to formally introduce you to our Prevent Connect web conference on community level and community-driven sexual violence prevention in alcohol serving establishments during the COVID-19 pandemic. My name is Ashley Klein-Jimenez. Use she, her, and her pronouns. I am with Valor US, formerly the California Coalition Against Sexual Assault. Prevent Connect is a national project of Valor US, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. Tori, I'm going to pass it to you to talk us through some of the objectives for today.
Yeah, happy to do that if I can navigate myself to the right slide. You click it once and it moves forward twice sometimes. So we do have some objectives for our time together today. We want you all to be able to describe the connections between community partnership and community level sexual violence prevention in alcohol serving establishments. Our guests will also help you identify examples of community level sexual violence prevention happening in alcohol serving establishments. And then all together, we will discuss opportunities for partnership and sexual violence prevention with local alcohol serving establishments. So in case you didn't get it earlier in the title, we're talking about community and alcohol serving establishments and sexual violence prevention. And one of the things and places for us to start when we think about preventing sexual violence in alcohol serving establishments is considering place, environment, and context for prevention. That's always important, but it's especially important when we consider just how much these alcohol serving establishments, and when we say alcohol serving establishments, we're talking about bars, restaurants, clubs, nightlife, whatever you want to call them. And I think it's an understatement to say that those environments have changed a lot in the last 15 months, and they're continuing to change too as more reopenings are happening. So it's important for us to consider situating prevention around like the situations and the context and the environments in which violence can occur. And it's so crucial here. And Ashley's going to describe how that has influenced one prevention strategy in particular with bystander intervention.
Thanks, Tori. Yeah, I mean, thinking about place, context, and environment in our prevention practice is really important in being able to draw on strengths and assets. And I think a strength of bars is that people are often there to socialize. And so many programs have really leveraged that social aspect to be able to focus on bystander intervention. And so this slide has some examples of bystander intervention programs and campaigns. And so the Arizona Safer Bars Alliance is a statewide program that trains bar staff to respond to sexually aggressive behavior. And it looks like, hey, Allison, we have someone from that program here. So if you have questions, we have Allison here. But moving on in Montana, the Make Your Move Missoula campaign implemented a social norms campaign to shift attitudes and beliefs that support violence to a new norm where community members are actively working to prevent sexual violence in their community. And then, as I previously mentioned, some of the work out of North Carolina, this example here really highlights the collaborative partnership the organization had with the bar to create materials that aligned with the culture of the bar environment. And so, Tori, thanks so much for putting those links in the chat if you all are interested in getting more information, and I'll pass it back to you.
Thanks, Ashley. That is a really important grounding to look at, where the work has been before, because we know that both the work and our context have changed so much in the last 15 months. So when we think about promoting safety and preventing sexual violence, like with any prevention context, this isn't just limited to bystander intervention. That's not the only tool in our tool belt, but we can also explore approaches that promote protective factors against violence, like community connectedness. Ashley, you said it before that alcohol serving establishments are a place for community and connection and socialization. And I feel like that's something people really tried to recreate during COVID-19 stay-at-home orders through things like the ever-present Zoom happy hours. When we're talking about connected communities, we're talking about members gaining a sense of belonging, purpose, and mattering from the experience of both deriving value from and adding value to their community. And this is something we saw a bit in the past year with the push to buy and support local restaurants and shops, as well as community organizing for racial justice. Stronger connections increase a person's sense of hope and self-worth and the ability to cope adaptively in the face of adversity. All of this meaning that community connectedness is a protective factor that enhances well-being, fosters resilience, and promotes prevention. A connected community is one where people build relationships and strong social networks and can thrive. And in this past year, many people were separated from the locations and the institutions that afforded them the opportunity to connect and socialize. Thinking about things like those post-work happy hours or networking events or just gathering with friends over drinks and snacks to recharge and connect. So as we transition into more reopenings, opportunities for both businesses and for increasing community connection abound. Much like how bar and restaurant owners are re-envisioning their environments for reopening, we have a similar opportunity to reimagine sexual violence prevention and nightlife during this time of transition. And Ashley, I think you're going to provide a little bit more information about specifically how and where we're talking about this today.
Yeah, so I'm excited that we are all together going to virtually travel to a specific area of New York where place and context also really matters in the way they approach sexual violence prevention. But as we transition to hearing from our guests, we'd also like to hear from you all.
We sure do. So this work has been going on before and it is continuing to happen despite COVID safety precautions and restaurant closures. So how are you currently partnering with bars, restaurants, and other alcohol serving establishments to prevent violence? And Ashley, thank you so much for pasting that question in the chat so folks can begin responding to it as we introduce our guests. So head over to the chat and let us know, how are you currently partnering with bars, restaurants, and other alcohol serving establishments to prevent sexual violence? As you're thinking that over and start pouring in your responses, I am super excited to introduce our first guest, Sarah Sampson. Sarah Sampson is the Rape Prevention and Education Coordinator of Region 1 at Suffolk and Nassau County in Long Island at the Retreat Inc. Sarah's professional experience prior to sexual violence prevention was working with families experiencing houselessness in Suffolk County. Welcome, Sarah. I am so excited to learn more from you today. And to get you started, first of all, you wanted to share your screen at this point, didn't you? Am I correct on that or no? I might be getting
do the slides. I don't have my own personal slides, but I can.
Oh, no worries. I just want to ask you first, what did this work look like for you before COVID and how has that work shifted?
Yeah. So first of all, thanks so much for inviting me to this. Pre-COVID, we really relied on, and I think took advantage really of, or took for granted, that face-to-face contact with partners. So we really utilized, some in-person marketing that we could do, some tangible things for folks that were coming into these spaces in Patchogue. To really not only market, what we were doing, but explain and be able to get folks to an understanding about the work that we were doing. So just in context, for those we're talking to folks all over, the United States. Long Island is in New York. The program that we run, Long Island Safer Bars, is actually on the south shore of Suffolk County. So very beach, town. It's actually in and of itself, Patchogue in New York has become quite a destination area for folks. So in the past couple of, I want to say 5 to 10 years, they've really had an uptick in, people coming from other locations to visit, not only to eat and drink, but to shop to stay, to go to Fire Island and go to the beaches and then come back after. So it has a lot of its own foot traffic going on, obviously. So that's kind of why we shifted our focus when we were creating this initiative to that area. So the project coordinator before me had picked Patchogue as a location because it is a very alcohol dense area. So we did some mapping, and it is, I want to say there's like 60 bars and restaurants now in a very small area. So breweries, distilleries, restaurants, bars, kind of a mixed bag of everybody. So before COVID, we really used that to our advantage. We were able to talk to a lot of people, get a lot of marketing materials out there by just one visit, because they're all on this main street within a mile or two of each other. About 2 miles would be like really the extreme far partner bar. Most of them are right on that main street strip. So we were able to really talk to people, create those relationships face to face, get our state marketing materials out there, like our posters, which is the help on the house poster that you see there. And then, we had stickers that we could put in the window if they were trained, which is the one in the middle. And then we had gotten some extra grant money through one of our partner agencies, to have coasters made. So we had, a bystander intervention logo on the front, and then on the back, a QR code that linked to all the different bars in that area that we were partnered with. So a lot of ways to really engage folks, not just hand things out and be like, hey, here's our materials, you're trained, but more like, how are you going to talk about this? What does this look like in your space? How can we be of more help? And able to kind of, slowly but surely collaborate with them, because again, we never thought we were not going to be able to do that. So it was really not time rushed. We really were able to see what worked, didn't work, what we would like to do in the future, and then everything shut down. So it really kind of, obviously, like most folks, pulled the rug out from underneath us, but really slowed us down in our work, which at first was, I think, like a lot of us, very unnerving, because I feel like in the prevention world in general, or direct services, or really any kind of sexual violence prevention, domestic violence, anything that you're doing prevention wise, it's go, 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 right? Like we are constantly planning, meeting, talking to folks about, what's the next thing that we can do? How can we make our programs better? How can we make our initiatives the best that they can be? This really forced us to slow down, which at first really freaked us out, not gonna lie, but it really became this opportunity to see what else we can do. What once we, over the first couple of weeks, kind of recovered of what was going on in the world around us, able to kind of find those opportunities for growth. So we not only had to shift our work, but we were able to slow down and strategize a little more. We got some COVID grant money. So how are we going to really be strategic about where that money goes? Who's going to benefit from it? Not just centered around what we need in our initiatives, but how can we maybe in the future help our community partners with these initiatives, incentivize our programs even throughout COVID. So those are some things that came up, and of course, always policy and marketing. How can we look at it different? I know everybody's saying like reimagining, sexual violence prevention, but really that's what it forced us to do, which typically we didn't really have the time to sit down and do, where we really were forced to be like, okay, we need to slow down and we have the time to look at all these things. So how can we take advantage of that? If you want to move to the next slide, please.
Sarah, this is Ashley. I wanted to just pop in really quick because I want to do two things. I want to share a little bit what's come up in the chat, and then I want to pose another question to you. But, we asked folks, how are they currently working with bars and alcohol serving establishments? And some of the themes, a lot of folks are doing outreach and trainings around like sexual harassment prevention or bystander intervention. Some folks are drawing inspiration from some of the other campaigns, specifically Make Your Move Missoula. A lot of people are here because they're looking for ideas. They're hoping that this is an area that they can move into, and so are really looking at ways to develop these partnerships. But there were a couple of comments along the lines of like building reciprocal partnerships with alcohol serving establishments. And I think that that's something that you all have really been able to do. And so I'm wondering how you've leveraged your social media and social marketing to strengthen your partnerships with local bars and alcohol serving establishments.
Yeah. So within those first couple of weeks of like really starting to get reoriented in our work and figure out what does this look like? Yeah, we definitely leveraged that social media tool for us, specifically Instagram. Facebook, not so much. I don't know what it is. Facebook has really fallen off, so it has not been a useful tool in really any kind of outreach, honestly, that we found, which is so interesting because like 5 years ago or even 10, Facebook was it. That's what we would use. So really utilizing Instagram as a means of like communication with a community that we could not see anymore, which is such a strange thing to think about, right? Like we were in this community. I live right near the community. This is a community we were really a part of, going to meetings face to face. They were starting to really like know us by first name and not just the Long Island Safer Bars people. Like we were really forming these relationships, and then it just stopped. So social media was a great tool to, keep those relationships there in a way that wasn't so insensitive also to what they were going through. Because not only are we going through, the COVID pandemic, but shortly after that, there was like this reckoning with, social injustices around racism and everything really. It really was like the world, our eyes were open to so much because we had to slow down and really introspectively look at like, how am I running my business? How is my community responding to these things going on around us? So it was a way to really communicate with them without being insensitive, without pressuring them. It really was a tool to just be like, hey, we're here to just be like, we would email them, do you have any specials going on that you haven't put out there yet? And when are you going to put them out there so that we can promote them? Really just promoting specials, hours that they were open, because there was a lot of confusion about like when folks were able to go do takeout. Just some things that we would see on social media pop up that were kind of like barriers for them that we can help them promote for. Do we have, we have a decent following. It was like 1,000 people. So that's 1,000 people that we can help, get over there and get to go food and all that. So that was like a really great way to connect with them on a different level and show like, yes, we obviously care about our work, but we also care about you guys, because without our partnerships, we don't exist, right? Without people working with us outside of the field of prevention, we don't exist. We need people who are not specific to this field to engage with us to really change communities. So that was like a really great way that I think in the long run, which I'll talk about a little bit later, I think really helped us to strengthen those relationships and show that like we are in it for the community, for the better of the community. We are willing to talk to whoever. We are willing to partner with folks who are interested in partnering with us. So because we promoted obviously the people we partner with, but also folks who weren't our partners, people we haven't had much conversation with, but we still wanted to show like we're backing all of Patchogue. We want everybody to do well. So to even do that even better and even more, we were able to actually hire social media consultants, which if you have the room in your budget or, have someone who knows how to really look at social media and analyze it and tell you, how it really works, that's something I would say is a great investment to make, because there's so much more than just posting a story. Like I know nothing about hashtags or any of that. Some of my coworkers were a little more savvy with that, but we were like a little like, all right, if we're going to dive into this social media world even more through the pandemic, we want to do it right. And they really guided us on the best way to do things, how much text to use in our, in our actual pictures, how to target certain communities, how to target certain age groups so that our posts were really it's becoming a social marketing tool, right? So we're really driving these messages to specific people, which was so helpful. We immediately saw growth in our social media, but not only that, but interaction, where for a while it was like we were doing these posts and we were, trying to make our social media posts more, marketed towards, what we're this health behavior we're trying to promote. But not much interaction, likes here and there, not too many comments. Now it's like a whole different page almost. And it really helped to promote this work that we're doing and how important it is and how everybody has a seat at the table, which I think was a really important component that not that we were missing, it's we were kind of neglecting it, we were focusing more on partners we already had and, communities agencies we were already working with, because we were, again, in that hustle and bustle of the day to day. And once we were able to slow down, it's like, okay, how do we get everybody here? How do we talk to people who know nothing about this work but are just engaging on social media? It was a really useful tool that we were able to use, and then go beyond that. Again, the social media consultants that we worked with were like, do more. There's more to do. There's more things that you could do. So the project coordinator before me actually allocated some COVID grant money to social marketing on different platforms. So not just, paid boosts and posts on Instagram, but beyond that with a local newspaper, but they're virtual, if that makes sense, called this one's Greater Patchogue. They have Greater Sable, different towns in Suffolk County that do this. And we were able to, if you see the banner that says no one can do everything, but everyone can do something. That's the bystander intervention focused social marketing tool that we, used, but it was everywhere. So we paid for I think it was like 6 months for it to run. And he actually got the statistics back to us not too long ago, and it was clicked it was clicked on higher than any national average that they've had before with banners, which was really cool. So we were like, wow, folks are really interested in this work without them knowing that they're interested in this work. But that idea of like, no one can do everything, but everyone can do something is, again, trying to drive that point home about the partners that we have, that we don't expect them to, end sexual violence, but them doing their part is like all we could ever ask for. And then on the right hand side is like an opportunity for folks to learn more. It's kind of like an ad that, obviously it looks like a Instagram post because it has hashtags and stuff. But if you click it, it went right to a website that would describe through the retreat, what Long Island Safer Bars is, who to contact, and the work that we did, which was really cool. So again, just different avenues that we really hadn't sat down to take the time to think of, like, how could we not only engage Patchogue more, but let the rest of Suffolk County know and Nassau County know what we're doing, because this work we are, region 1 is Suffolk and Nassau. So that's a lot of ground to cover. If anybody saw that island, we're half of that island. It's a lot. Long Island is long. So we really were like, how could we utilize, this virtual space, since the physical space has been taken away from us, which was really helpful. So with that, we wanted to also focus on social norms, and social norms is like that tricky, how do you make that work in social media kind of thing? Because again, with RPE, it's rape prevention education is our grant. We're limited in the materials that we have, right? We're given this certain amount of materials and they're great, but we want to always be doing more and engage people on, not just the physical space, but the virtual space. So this forced us to look at that virtual space more closely, and how can we create a social norms campaign, again, use those COVID funds strategically, so that not only are we creating this social norms campaign, but we're leveraging it. We're going to have these paid posts that are strategically placed throughout, a certain amount of time to a certain group of people. So we specifically picked that 18 to 24-year-old range, because that's our catchment age in the Patchogue area. So that kind of helped to focus the social norms campaign, so that we made sure that we were reaching people. And again, we looked at our risk protective factors that we have from guidance from the CDC and said, how can we create some posts that will not only target this, but be relevant to the bar community, which took a lot of time and a lot of like thinking outside the box and kind of, again, working those brain muscles that have been not being used, because again, you're face to face, you're doing the work every day, that kind of slowing down and saying like, okay, now how do I be super intentional and super sensitive to, again, the climate of the world. But again, we found it to be really helpful. Even now, some of these posts went up a couple of months ago, and we still get notifications because they are paid ads, they are targeted. So it helps to kind of keep them going and keep them relevant, which was really helpful to do.
Thank you so much, Sarah. That it's really great to see how you were able to take kind of this time where, a lot of us were just trying to figure out what the heck to do. And you were able to take some of that to really look at your strategy and how you could pivot in a way that would be able to advance the work, even when things kind of shifted again. There was a question that I wanted to pose to you and get your thoughts on, and it was specifically around considerations with the use of the window stickers. And so the question is really like, how did you ensure that bars that received those were continuing to sustain and practice what you all had trained them on? Did you have any thoughts around that?
Yeah, so that kind of goes back to that relationship component. So through COVID, that was really hard to kind of touch base and again remain sensitive to the things that they were going through as a business, because a lot of them didn't know if they were going to open their doors again. So pre-COVID, it was a lot easier to navigate that and have discussions around, just check-ins like, hey, how are things going? And not just with owners and managers. This is like staff too. Making sure we touch base with owners and managers, obviously, but they're not typically the ones interacting with customers all the time. That's going to be servers, bartenders, hostesses, which actually hostesses I find have the most intel on what's going on because they are literally people watching half the time. So they see a lot of what's going on and kind of just touching base about, hey, how are things working out for you? Doing a follow-up, after a couple of months, we try to do 3, 6, and 9 follow-up, month follow-ups. But we definitely interact with them more frequently with them about the things that are going on post-training. So we will talk to them and ask like, how are things going? Is there anything that you have seen change? A lot of, partners that we have strong partnerships with, they will take the time to sit down with us and be like, this is what we've seen improve. My staff is much more comfortable coming to me now that we've gone over the policy piece and they know what's expected of them. So definitely keeping up with that. And then just keeping a pulse on the community, right? So if we have community partners who are stakeholders who know what's going on, I'll touch base with them. And they might not be necessarily in the bar and restaurant industry. These may be just community partners who just have really great intel and are always talking to local legislators or community members about the things that are going on. So making sure we periodically touch base with them, say like, hey, they know who we are and the work that we're doing is there anything that we should maybe know moving forward with these partnerships? Another great way is just like we keep a pulse on social media, any news headlines that we may see. So if there is a partner who, we're not getting the best feedback, that, some of the things that they're doing don't align with our work, we have to be really strategic in how we approach that. We're not calling them out necessarily on the negative stories that we hear. It's more like checking in and framing our questions to see if maybe they don't know that that's something that happened at their establishment, if it's an owner or manager, or they did the best that they could do. and they just need some more help. So we try to not be come with judgment, around some negative things that you may hear, but instead come with like, hey, we're also a resource for some assistance. So like if you experience something with staff and they didn't handle it the best way, maybe we need to look at their policy. Maybe it's a partner who wasn't too into policy before around changing their policies, where something happened that now they're like a little more open-minded to it. So it's hard to keep up with, we're not going to helicopter, right? We can't monitor every single thing that's happening at these establishments. But for the most part, folks who are doing this training and are partnering and are working on policy and looking at their environment, they're doing it because they care. So if something does happen to the extent where they need some extra help, they will tell us stories. We've had places that are like, oh my gosh, this happened last weekend. I don't think we handled it the best. Can I run it by you? Do you have any input on how it could have gone better? So again, building those relationships, it takes some time for them to start to really disclose some of the things that are going on. But I think just, maintaining those relationships, keeping a pulse on the community and the nightlife, you'll start to hear some things that may not be the best. But I think if they're doing the work, you can bring it to them like, hey, I just want to, let you know that I heard this, in social, the social media world. And they might be like, yeah, it was bad. Can we talk? Or they might be like, we handled it. This is what we did. And they handled it great, after, and they told their staff that, this is the better way to handle it. This is how we want to move forward and handle things. So I think you'll get a mixed bag. And then there'll be some partners that are like, we don't have a problem. This isn't an issue. And honestly, that's something that we're, still trying to figure out is like, do you stop partnerships? When do you stop partnerships? That can kind of be a gray area. But I think it's just really, I'm going to say case by case, because that's just like the lingo that I feel like I need to use, but really partnership by partnership, on how you would address it.
Great. Thanks, Sarah. Will you talk a little bit about the work that you're continuing to do throughout the pandemic?
Yeah. So once, I want to say like, after actually we started doing some trainings and new partnerships over the summer. So once things started to not really open up, but we were able to kind of go talk to people at least. We took the opportunity to do that, obviously safely outside, and really started to look at like, okay, what is this work going to look like throughout opening up, because we knew things were not going to change overnight. A couple months into the pandemic, we were like, all right, this is going to be our life for a little bit. So we need to figure out what that all is going to look like. We were able to, during the summer in between, starting to approach, partners about how they're doing, what's going on with them. We actually did a commercial. So we, again, used some COVID funds to do a new commercial for Long Island Safer Bars to share with community members, partner agencies, really anyone, put it out in the news just to let folks know that we're still doing this work, and kind of give an update on more of what it looks like for the community. Because I think in the past it was like, oh, they just come in and do a training. So we wanted to shift that idea that we just come in and do bystander intervention training, because that's not it. That's not the only thing that we do. So able to frame it a little more like it's a community, led program that really we work with the establishments, we work with, our local chamber to do this work. So after we had done that, again, we used the COVID grant funds to offer some training to our existing partners. So a lot of them fell out of, our certification process. So they didn't have 70% of their staff trained. They had a lot of turnover. So we kind of use it as a way to check in and say, hey, how are you guys doing? We're still here. We're not going anywhere. What's going on with you? What does the next couple of months look like for you? And a lot of them were like really happy to hear from us, which honestly, we were a little nervous to reach out because it's like they have gone through so much. Like their livelihood has been at stake for a while now. So it kind of was like, is this the appropriate time to talk to them? And by the summer, end of summer, they were happy to hear from us. They were excited to talk about something that was not related to COVID. So it was definitely a shift in the conversation. So we, said like, would you like to do some recertification training, get our partnerships back on track? And a lot of them, we had about 5 places that were like, yeah, sign me up. Because we were able to, instead of them, paying their staff, they have to pay their staff an hourly rate. They just wouldn't clock in, and we were able to pay them with the COVID funds, which was great because it felt really good being able to offer that to them. For the 5-hour training for that hourly rate for a lot of them is food on the table. That's just an extra set of financial relief that we could offer for them partnering with us because they were hit really hard. It was tough to see some of our partners really struggle. So we were able to do some trainings and recertify some folks, and it was great. It was like, again, a whole new feel for the work. Again, I think because a lot of people had to slow down. They're hearing things in the news. They're hearing local statistics for Suffolk County about the rates of domestic violence, child abuse, and how it's another, it's a silent pandemic in and of itself. So I think everybody's perspective coming into these trainings were a little different. It definitely felt like a shift in the rooms. So that was like kind of great for us because it was a little bit of a window of opportunity to really dive into the work with groups of people that, don't get me wrong, were amazing pre-COVID, always wonderful and always, willing to talk. But I just felt like their perspectives changed a lot throughout those months of being home. So it was really interesting, and they were excited to see us because, again, these are existing partners. So these are people that we've already worked with before, and they were like, "You're back. Awesome." Like, again, this is not related to COVID. So I'm so excited to talk about anything that's not related to COVID. Because they had to do trainings of like how to serve, they're relearning how to do their jobs. So it was nice for them, I think, to just come and talk about something else, even though it is really a serious topic. But we kind of engage them in a way where it's interactive. They give a lot of input. So we were able to do that, which was just amazing. Which then in turn actually reignited some policy and environmental work. So after we do our training with folks where we do touch on policy and environment in more of a broad sense, and kind of get ideas about like, what would you like to see change in your establishment? What would you like to see change in your community? I take all of that, and whoever's willing to give me information they'd like to pass along, so their anonymous packet of like ideas that they have, I kind of put everything together and then go to a separate meeting with just owners and managers who are typically at the trainings, and sit down with them and say like, here's some feedback I have. What would you like, your space to look like? And how can we kind of meet in the middle with my background and your background in the restaurant industry to strengthen your policies to, for sexual violence prevention and in general, because they might come up with things that aren't specific to sexual violence prevention, but align with the work that they want to see change. And again, so different, such a shift. Typically a meeting that, they wouldn't rush me, but it would be a different, like, I have this, we have this amount of time and then I have to go and, run this event over here, like they're immediately shifting into their work. I would have like hour-long conversations about, hour and a half about the things that they would like to see change in their establishment, feedback about, security that they're using and how they want to incorporate, their trainings into what we're doing. So a lot of, again, different slowed down approach to this work, which was awesome. So we were able to meet with folks after they did the training, and kind of talk about how they would like the work to look moving forward, which led to one establishment that was like, I don't have a written policy handbook at all. And I would really like one, because a lot of the places, it's a lot of verbal policy that I'm like, that's awesome. You have really great ideas. You're doing a lot of great stuff. Let's put it on paper so it means something, like let's make sure that this great work that you're doing and want to do is there for you to back you up. So one establishment wants to, and we are in the process of working on, an in-house policy handbook, really led by their ideas. Because again, we know the sexual violence prevention part, but they know the industry. So kind of giving us ideas to work with, so that we can then, create some policies and go back with them and see like what it looks like. That now other folks, when I'm like, yeah, I'm creating a policy with this, or a policy handbook with this establishment, they're like, oh, great. When it's done, can I take a look so that I can use it for mine? So it's kind of going to become this like little menu for them of like what policies they would like to incorporate in their own establishments, which is, again, not something that was easy to sell pre-COVID. So again, I don't know what shifted throughout this community where they are just really digging into this work. It's like they were on a reset, and now they're like, they have this new perspective, and they're like, yeah, let's dig our hands into it, which is amazing. And I think, again, it really comes back to those relationships that we had cultivated pre-pandemic, and maintained throughout, which was awesome.
That's Sarah, I want to stop you just because we need to move ahead a little bit, but I wanted to let you know that there are actually quite a few questions in the chat for you, wanting to know a little bit more about the work that you're doing. And so one is, just really asking how you were able to maintain that close contact with the staff, to like do the check-ins. And then there's some other questions just wanting to know a little bit more about around the specifics of the content of the trainings that you did with the bars. And so it would be great if you could head over to the chat and answer those, if you don't mind. But I just think it's so great that you've been able to build this relationship with the partners and stakeholders. And so any final thoughts on that aspect of your work, because it's such a huge one. I think people struggle with partnerships, and you've done such a wonderful job of maintaining this throughout a really trying time.
Yeah, I think the scariest part of relationship building is you're working with folks who are not part of this work, right? They're not in the prevention field. It's a very non-traditional setting. So I think practicing and making sure that your pitch is relevant to the community that you're in is a huge part of it. I'm not going to walk into a space that's, a non-traditional space and start talking about sexual violence prevention. I'm going to word it a lot differently. I'm going to talk about healthy, safe spaces and fun nightlife, right? So I think practicing that before you go into these communities and making sure you're culturally relevant and just not going over people's heads is a really simple way of just engaging these communities. Because once you do start to have these conversations, you're going to find a lot of people are more interested in this work and keeping their communities safe than we think. And it really is like the lifeline to this work is that community connectedness and that relationship building.
Absolutely. Thank you so much, Sarah, for sharing about all this work. I know we're going to bring you back and hear from you a bit more in a bit. But like I said, there's some questions for you over in that chat. So if you wouldn't mind just taking a look and seeing if you can answer some of that, that would be awesome. And thanks again for everything that you shared. We actually wanted to turn it back to our audience and hear from you all again, thinking about, all that Sarah's just talked us through in terms of maintaining partnerships. We're wondering how you've been able to maintain partnerships for prevention now and in the future. Like what are some of the things that you've been able to do? What are ideas that you may have for maintaining those partnerships? We'd love to get a sense of that. And I think, Tori, I'm going to turn it over to you so you can introduce our next set of guests from New York.
Of course, happy to introduce Michelle and Eric. Michelle Hankhouse is the Senior Prevention Program Coordinator at the New York City Alliance Against Sexual Assault, where she coordinates New York State RPE, Rape Prevention and Education program activities within the New York City region, including sexual violence prevention in nightlife and neighborhood spaces. She has a master's in public health from Emory University's Rollins School of Public Health. But first, we're going to hear from Eric. Eric McGriff is the prevention coordinator at the Crime Victims Treatment Center, Inc., where he aids in the planning, implementing, and evaluating of community-level efforts to prevent and respond to violence in underserved communities throughout New York City. He is also a global peace ambassador, working as a facilitator and trainer to advance various initiatives at the intersections of youth, gender, and violent extremism within the UN network across the globe. Welcome, Eric and Michelle. I'm gonna turn it over to Eric first. Eric, can you tell us about your approach to sexual violence prevention work and just the impacts that it has?
Yeah, for sure. So at Outsmart, I sort of represent the really, really local piece of our approach, and I am the part that I hold myself accountable to the frontline folks and their experiences in New York City. And so for us, one thing that we know about our work is that it is a VUCA world out there. Do you mind clicking? In VUCA, it means volatile, uncertain, complex, and ambiguous world, where change is ongoing, right? Change is continuous. So part of what we want to do is make sure that we're using an approach that is also, capturing what's emerging as the world continues to evolve and change when things like COVID happen. Would you mind clicking a couple more times? And so in the world that we live in today, we know through the rise of information technology and globalization, we are now more connected than we have ever been. And we have more diverse work environments than we've ever had before, right? And so part of what we need to understand, in our approach, is that machine model technical interventions offer at best partial solutions. Because the systems that we're working with are complex adaptive systems. They are living systems. We all impact each other. We are impacted by things that are happening outside of our work environments. And in a world that is always changing, the end point is unpredictable. What's going to happen tomorrow is unpredictable. And so that we know in this complex world, change is not linear. Identifying preset goals and objectives and wanting to hit them in a linear fashion, it doesn't really work. And so for us, it's about really having a shared vision of that world we want to reach and really moving in a direction, right? Conducting safe to fail experiments, probing the systems that we're working in this really diverse community and learning and failing forward so that we can, sort of be adaptive. But we always center frontline folks. Next slide, please. And so for our approach at Outsmart, part of what we like to do is bridge the gap between evidence-supported interventions and the real-life local context through facilitation that integrates the combined expertise and sees people as whole people, right? We don't want that machine model implementation. One of the things we recognize is that a lot of best practices are actually past practices that were developed in predominantly white institutions. They are absolutely helpful. But they aren't always, the most helpful when we're talking about things that are emerging and evolving with us day after day after day. And when we're working with the nightlife community, it's important to recognize the hospitality industry, right? They've taken a hit. And so part of what we do is also fold trauma-informed practices into our public health approaches for more accurate data, for more inclusive solutions, and to create conditions for that ever-evolving context to emerge. And so part of that means recognizing when you're working with hospitality, this is an industry where folks are experiencing sexual harassment at a higher rate than any other industry, where folks are tipped workers and they feel like they often have to deal with the abuse or the harassment they're experiencing from patrons because they need their money in order to pay their bills, especially in New York City. This is a community where we have large communities of color and communities that have isolated as a trauma response, right? Shut themselves out. So just by asking, doing some focus groups or doing a training or making an initial connection, it doesn't mean that they're going to be fully candid with you, right? You have to build that relationship. They have to feel a sense of psychological safety, right, to be candid with you in that way. And so when it comes to our approach to working with communities, we center cultural humility and humble inquiry. We center psychological safety because we know that, okay, I can have my policies, I can do this training that's been evaluated, but if I'm implementing it in a place where we start the training by HR apologizing that everyone has to learn about sexual violence, that doesn't set a good tone. If we're in a place where the norm is that servers are experiencing sexual harassment and people are saying, oh, well, that's just how the industry is, that's not really good for us to create this innovation. And it's also important to recognize that innovation and change is scary. We are hardwired for it in terms of the fact that we're human beings, we're always evolving and changing, but we're also hardwired against it because it doesn't always feel psychologically safe to change. Right? One of our biases is to go back on things that have worked in the past, and there's definite survival value in it. But again, we are always looking at the emerging context that's coming out of the work that we're doing. And we do this for a few reasons. Next slide, please. Can click, I think it's, yeah. So one of the reasons that we use our approach to bridge the gap between facilitation and evaluation, tap into the expertise, the folks who are in the room and the way that we create our training, is for epistemic justice. That's fairness and knowledge and how knowledge is produced. It comes from the British philosopher Miranda Ficker's identification of the unfairness built into systems of knowledge production, where certain viewpoints and personas are more represented and hold more power. I'll say, as the queer person of color on this panel, right, it is my experience every day that white people take parts of my culture, take our language, assign their own value and meaning to it, and then distort it, and then demean it. And because there are so many of them, once they come to a consensus, like that's what the new meaning is, even though it's something that came from my culture. And so you put me in a focus group, you give me some surveys and some trainings, I'm not going to be fully candid. It doesn't feel psychologically safe for me to be candid in that way. We also think, we take a lot. We don't value the perspectives of folks who are not presenting the information or the data in scientific or mathematic formalisms. And that sends a message, especially where you learn to, create or present these scientific and mathematical formalisms is through academia, which is really exclusive, right, and not as accessible to marginalized communities. And that's something we see in New York City as well. We have a nightlife mayor here, and they've done focus groups for thousands of people in each borough. And one of the things that came out is that a one-size-fits-all curricular approach does not meet the needs of poor, minority, and marginalized communities. So part of what we need is an approach that is scalable and adaptable, and that is supported by the evidence we've gathered. Next click, please. We use this approach for disintermediation, which is reducing the intermediary interpretation of data and information to put decision makers and stakeholders in contact with the raw data, rather than pre-analyzed results. This is a community that is very, very conscious that people who are not from this community think that they're not educated. This is a community that is super, super prideful, that know that they are great at what they do. And when we walk into a venue, they always ask us, have you ever been a bartender? And when you say no, you can see it in their face. You can see that they're expecting you to give something that is surface level inclusion, surface level relevance, and you can see how that impacts them, because it's just another 101 training where we brought in an outside consultant to tell us how to do our job, even though they don't know what this venue's local context, relationship, problems are. And so in our venue, we use facilitation to help expose a lot of the contradictions in the paradox, to put them, to include them as folks who are producing and co-creating the data and solutions that every venue has, differently, because the venues are so diverse. Next click, please. We do a lot of sense making, and that is knowledge production as an activity, where we use data towards shared understanding of problem areas so that we can generate the right action, right? So one thing that we do in our training is that when we're creating scenarios, we don't come with predefined scenarios. It is actually a part of our training to, It is actually part of our training to, when we get to scenarios, have them create the scenarios. And the scenarios they don't feel safe about talking about because their managers in the room, hey, psychological safety, they put an X on it. And that's stuff that we can mark and that we track and outsmart as we keep all those pieces of scenarios. Next one, please. And so part of the way that we do this is by using complex facilitation. It sounds complex, but it's really facilitation meant for being in this place of complexity where we know, cause and effect aren't really knowable unless it's in retrospect, in a place where we know there are a lot of unknowns and unknown variables in the system because we're not experts in the space. They are. And so complex facilitation is an approach to facilitation designed to encourage emergence and allow for diversity. This form of facilitation disrupts regular group dynamics and facilitates through encouraging emergence and flow. And we try to do this in everything that we do. At Outsmart, we have a collective that meets monthly, where we get together with frontline folks and we talk about what's going on, talk about what's in the news, talk about how they were bystanders and what worked, what didn't work, and we provide ongoing support. We have a Safer Spaces Committee that we just formed with the Nightlife Mayor's Office because of the emerging need, the need that's been there, for a more intersectional approach to bystander intervention, right? The interventions that can be used maybe in a sports bar near NYU are not the interventions that can be used with our bars in Brooklyn, where all the staff and patrons are queer people of color, right? There are things that are not safe, and they literally will ask us, tell me how this training is going to be different from the one that you presented to the all-white bars, because we know that it's not safe for you to just come and do it like a one-size-fits-all training. And so we also have a policy work group that Michelle's going to talk to you about. Our Safer Spaces Committee, though, centers frontline folks, right? Because they're the ones facing the problem. And we know that when you're brought in as a consultant or an outside program from leadership, the problems leadership identify are often different or not as nuanced as the way frontline folks experience them, because due to a lack of psychological safety in an environment where sexual harassment and violence is rampant, a lot of the frontline folks aren't sharing their frontline experiences with leadership. But leadership thinks, I have an open door policy, I have a zero tolerance policy, we're a family. The professionalism is expected to facilitate the proper communication, but it doesn't. Right? And that's like a white supremacy culture thing. We have a community mobilization model. We have a 3.5-hour training because one of the things that we are consistently told is that even our 3.5-hour training is too long and that we can't get people for multiple sessions because in most of these bars, people work at different venues, right? It's super, super important for us to be adaptable because we know the venues are different. We have polyamorous play communities presenting it. We presented and been bystanders at raves. We've worked at BDSM parties. We have bars that, again, have queer people of color, or bars that in one night have, EDM music and another night they have Caribbean music. Different norms, different strategies, different populations. So again, our facilitation, our complex facilitation is open enough, and it has us as facilitators demonstrating humility so that we can create fertile ground for the emergence of the true context of each venue that we're in. And it also disrupts this idea that we're going to come and tell you how to do your jobs. At Outsmart, we also just hired a bartender who works 15 to 20 hours a week to help make sure that we are not doing anything without the active inclusion of these folks. Everything from our policy to our trainings to our campaigns and even like our parties, they are created, implemented and evaluated with nightlife folks side by side with myself and Michelle, because they need to be included, and including them and building that relationship through humility, right? And through curiosity, because we know there's a lot that we don't know that helps create fertile ground for the relationship that gives us access to the unknown variables that a lot of people don't get if it's just machine model implementation. And with that, I'll stop because I know Michelle's got stuff.
Wow, Eric, I'm just sitting here kind of speechless in everything that you shared with us about how crucial this approach is. And I kept hearing so much of like prevention come up in your approach too. I had one clarifying question that I was hoping that I could ask you to answer. So right around when you were talking about disintermediation, Erin asked that Erin missed the thing that you said that turns people off. Was that about, have you ever been a bartender? Was that what that was in reference to?
Yeah, it's definitely connected to it. They ask us all the time, have you ever been a bartender? It's a thing, and this isn't just, in nightlife training, this is all over the place. Leadership often identify a problem, they bring in an outside consultant who doesn't have the local context, and then as facilitators who might only have an hour, 2-3 hours in the presence of everyone, there's a lot of time that we are sort of like throwing away sharing best practices, which are often past practices from other contexts, predominantly white institution, that aren't tailored to what this community is experiencing. I could give best practices, but I don't know what this community has considered. I don't know what's relevant. I don't know what they see as acceptable, accessible. I don't know if those best practices are things that they just didn't want to do because it doesn't jive with their culture. So it is my benefit as a facilitator who wants to gain access to those unknown things, who wants to empower that bottom-up feedback so we can increase our adaptive capacity to create a facilitation format where I'm relying on them. And that can be as simple as me putting up an anonymous poll saying, what are the critical conversations we should be having about sexual violence so people can be candid knowing no one's going to know who sent it? And then another poll saying, why aren't we having those conversations, right? Participatory decision-making is a super, super helpful facilitation tool for demonstrating humility and tapping into the expertise that lets you tap into the evolutionary potential of any community you're working with.
It's so thoughtful and it makes so much sense. You said, doing things that jive with the culture, and that is the whole goal and point of partnerships and prevention too. So Eric, I really appreciate you grounding us in this. And I do want to let folks know that Eric has provided a wonderful resource sheet that will be available at the conclusion of this web conference. So it'll be available where you can download the slides and eventually view the recording too. So thank you so much to Eric. And, I said it earlier, but there was so much of what you said that you were talking about an approach and a process to prevention, but there was sexual violence prevention within your process as well too. And so I want to ask our audience, how can you practice prevention in your processes? Prevention isn't just the thing that the goal, it's the how too. So how are people practicing prevention in their processes as they're doing policy change or work with bars and alcohol serving establishments? I want to welcome Michelle into this conversation too. And Michelle, I want to ask you, how has this approach informed your nightlife policy work, both before and while you're shifting due to COVID-19 too?
Yeah, thank you. So building off what Eric has told you about our Outsmart NYC approach, that approach is driven not only the development of our training and how we conduct our trainings, but also our policy work and social marketing approaches as well, and has really been integral to adapting our work during COVID. So you can click again, please. Yeah, so before COVID, we worked on policy change by convening, like Eric mentioned, a regular policy work group that consisted of nightlife owners, managers, and other industry stakeholders. And the goal at the outset of this group was to engage nightlife and service providers to take actions to strengthen and advocate for policies and improve practices related to sexual violence prevention that are driven by nightlife and driven by best available evidence and knowledge. So some of the things that we focused on pre-COVID was to develop a management training with this group of stakeholders on sexual harassment, premise control, and venue policies, and then also create a sample sexual harassment venue policy template. But during the pandemic, the work group became integral to determining the focus of our work even more. You can click again. Yeah, keep going to the end. So this work group, it served as a touch point to talk about current industry needs during this really evolving time. Things were changing so much throughout the past year, are still changing. What operators are facing, where their priorities were at the time, where there were opportunities to further our sexual violence prevention work in these spaces, and where we needed to pivot our current work, pivot away from trainings as things were shutting down. So through these touch points and discussions, some of the things that we pivoted to as the trainings were on pause was to focus more on some external policy advocacy and internal policy and venue assessment tools to help managers and owners to be able to assess policy, make policy and environmental changes that they could use now or at a later date. So something that we've been working on over the past year, it started pre-COVID, was our stakeholders brought up a need for enhanced training for security guards working in alcohol serving establishments. And before COVID, we conducted interviews with security guards to determine what the needs were, to conducted interviews with other nightlife stakeholders to understand the issues and what security guards needed to be trained on. So over the past year, we focused on advocating for this and have started some state level advocacy for training requirements around this issue. And I'm going to talk about this on the next slide a bit more, but we also worked with the policy work group on developing a best practices toolkit and guide to guide venue operators on potential changes to policies, practices, and environment. So they provided really key feedback and input to the development of this guide and tool so that we could make sure that it was responsive to their needs, responsive to the context they're working in, and included the best available evidence for them to provide feedback on how it related to them. So next slide. So a bit more about what the best practices toolkit entailed. You can click, yeah. So the overarching goal for this guide was to provide owners and managers tools to assess their establishments, making more informed decisions on venue changes that will help them create safer nightlife environments. But we strove to combine, evidence-based research with community stakeholder input. So you can click again to make it more responsive and usable, like I just said. So to do this, we combined, our own expertise that we were bringing as sexual violence prevention advocates, expertise of a research team at Rutgers University School of Social Work, who completed a literature review, and the expertise of our nightlife stakeholders and industry professionals through the rounds of review and feedback that we had with them during our work group meetings. After compiling the research on policies, practices, and environmental considerations that exist, in documented literature in nightlife spaces, we sought feedback from our nightlife stakeholders about those recommendations and the tools that we could develop from that research that they could use to assess their venues in those areas. And so some of the feedback we sought from them was about what was relevant and what was not, especially, in their local context. We're really focused on the New York City nightlife community. What would be most useful to them in digesting some of the recommendations and assessing their own venues, and then what will nightlife owners, managers, and frontline staff be receptive to with these changes, and how can the best practices be framed into a usable toolkit and guide. You can click to the next slide, and I'll go into a bit more what was included in the guide and toolkit, what it looks like. So overall, we ended up with 3 components to the toolkit. So first, we present what the research says, what our entire literature review came up with about best practices and recommendations. And it's divided into 4 key areas. So frontline staff training is an area that we describe, social and physical environment, managerial approaches and venue policies, and then a venue's role in public education around sexual violence prevention. So we describe each domain or area is described in depth according to what the research says. And we include information on, what is important to consider within these areas. The audience for this is nightlife owners and operators. So we really want to make sure they understand, why these are important considerations as well, we describe, and then what recommendations exist around that area. So we provide, suggestions of considerations for the social and physical environment, considerations for venue policies. On the next click, from there, we created a holistic venue assessment checklist around those areas. And so that, we had previously done work with our policy work group around suggested venue policies and environmental tools, but we created something building off of that previous work and adding in the literature review, and then, getting the feedback from our current stakeholders over the past year. And this venue assessment checklist is really to allow venue owners and operators to examine their current policies, practices, and environment within their establishment, recognize aspects that can be improved upon, and then reassess continually to track their progress, record improvements. They can use the checklist again at a later date to see how they improved or what changed in their venue. And then finally, if you click again, we included an organizational readiness assessment tool so that owners could better understand whether their venue staff are willing and able to implement a particular change. So they use the venue assessment tool to see what changes they might make. They use the best practices suggestions. They could read about the different areas that they could improve. And then they need to see if their staff and their venue is ready. And so that, asks where staff stand on their commitment to change, how they feel about their efficacy or their confidence in implementing a change, and change valence. So what kind of value they see in implementing a change in the venue they work in. And so that is really to help owners understand where their staff are, how successful this might be, whether there's other changes that need to be made beforehand. And that's going to help them inform and decide their venue's best next steps. So overall, when developing this toolkit, we wanted to provide the information and best practices from the literature, but also recognize that owners and managers and operators are still experts on their venues. So these tools that we created were to help facilitate or guide that process for change, but also meet them where they're at and give them something that, it's not going to judge them, but give them more information to help inform these decisions that they're making on venue change. And then one more slide. And so one other adapted activity we undertook during COVID was to develop a patron-focused print campaign adapted to the current context. So before COVID, we had worked on social marketing campaign messaging, but when COVID hit, nightlife and the context of nightlife changed drastically. So we brought together a group of stakeholders, folks that worked in frontline staff positions and the nightlife industry to talk about what was important at this time, how the context had changed, what we should be reaching patrons about. And they brought up, now was a time to reimagine nightlife, what it should look like coming back, what we want to leave behind. So we came up with messages. They brainstormed a whole bunch of messages around consent, what it means to be a bystander in the nightlife context, in the nightlife COVID context, all the different scenarios, what it looks like now. So, new nightlife context they brought up that they wanted to address was COVID dating, how patrons are navigating safety, in this new context applies before COVID. So our messages ended up centering around consent and bystander intervention. And they really wanted to tie together, driving home the point that consent was important before, but it's tied to COVID, especially now, making safe nightlife spaces ties in sexual violence safety as well as COVID safety. And so really making the messages specific to the time that we were developing them in. And they really talked about community care too, and how COVID brought up to the forefront, like questions and the idea of community care, and that's really integral to nightlife as well. And driving that home to patrons could be really impactful when talking about sexual violence prevention and safety in general in nightlife spaces. So we created messages with them relevant to this period, talked about, the focus, what risk and protective factors for sexual violence prevention we wanted to focus on, and kind of married them together. And these are some examples. We talked about also adapting the materials to reach patrons at this time, nightlife looks different. It's, you know, it was more restaurants, to go messaging, to go like food, eating out. So we created coasters for outdoor dining. We have inserts that can go in to go, like restaurant bags and stickers and things like that to adapt the type of materials we were creating as well. And so those are some of the social marketing and policy approaches we took during COVID, and how we stayed community driven throughout our work and our adaptations. And I'll stop here and turn it over to Tori or Ashley.
Thank you so much, Michelle. It was, you've had so many questions come up in the chat, but Eric's been doing a fabulous job of responding to them. But like walking us through the policy approaches and your social marketing approach, I feel like I learned so much. You really kind of harnessed the all of the work that you've done building those relationships and letting the community really drive the work, and you know, connecting that to the current context and how so many things have changed, and thinking through like what do we want to keep, what do we want to leave behind. So I just so appreciate everything that you shared. I want to ask our audience, you know, a lot of what we've heard today has been like this reimagining of what nightlife can look like in our communities. How do we put connection and prevention really like at the forefront of nightlife? And so I'm wondering how you all can think about reimagining nightlife for connection and prevention. We'd love to hear from you. And with that, you know, we only have a couple minutes left, but I want to bring back Sarah, Eric, and Michelle to talk a little bit about reimagining nightlife, connection, and community. And I will also say there was a question early on, and it made me think, I think, Eric, you were the one that used the term frontline staff centered. And the question was, you know, what kind of work did you do with management to make sure that staff would be supported in maybe addressing issues that they were seeing in their establishments? So we'll have a few minutes to hear from each of you, but if you have thoughts around that question specifically, it would be great to hear. So I am going to just open it up. Sarah, Michelle, Eric, how are you reimagining nightlife, connection, and community?
Thank you for that. And for me, I guess it goes back to what I was saying before. We know that being a leader or someone who has power in an organization, that affects what people will share. Right. One of the terms I like is here and now humility. It's the humility that I have when I'm dependent on you to get the job done. While those of us who have supervisors know what that is, oftentimes leaders and folks with power titles who think that policies and being open and welcome is enough for folks to come to them. But we don't. And we think leaders need to be a bit more humble in their inquiry. Humble inquiry, that's a great thing to look up, love it. Because there are barriers. And so the great thing about being a facilitator who's coming in, this is where we can leverage our position as someone who is outside of the agency. We've worked with over 60 venues now, some with our 101s because 3.5-hour training was too long for a lot of them, but some through our venue trainings as well. And so we know a lot about what's going on generally, but we don't know what's going on specifically in this venue. So through things like facilitation probes that tease out paradox, that get to a lot of the challenges we know frontline folks are facing in the presence of leadership, we can help hold that space. It's sort of like in therapy where you create a holding space where someone can feel safe enough to share stuff. We try to recreate a safer space for folks to really be candid. And we try to talk to leadership, hey, like part of making this change is not just the technical stuff. It's like, how do you provide cover for the candor that you expect your employees to give to you when it comes to talking about these really, really hard things? We provide trauma training on how you respond to disclosure, and more enhanced sexual violence or bystander intervention trainings that have a more trauma focused, a higher trauma focus on them. There are a lot of other things, but I'm gonna pass it off so others can speak.
Thanks, Eric. Sarah or Michelle, do either of you want to weigh in?
Yeah, so something that has actually come up, not only in, when we're doing the trainings about, just being a little more open. I think we break the ice a little bit. Honestly, just something as simple as that is like, I am a bartender, so it kind of is easy for me to break the ice because I'm like, I get what you're going through because I go through it. So kind of creating space for them to be a little more honest, but also just it's really a space to just again, no judgment. If their managers or owners are there, this isn't like an attack on their establishment. This is an opportunity that they don't get very often to come together and really have the time to look at their establishment and look at how it is running and how maybe they want it to be differently. We've had staff be very outspoken, like they're very against ladies nights, and they were not they felt good saying that in front of their owners and managers, because the space was very open, and we created a safe space within the training. And then outside of that, again, just checking in and creating these relationships with them has been really helpful. As far as reimagining, nightlife, I think more than ever, we're understanding that our work really aligns with nightlife. And I think nightlife is starting to see that and get that and understand that. And community connectedness is just such a huge protective factor for sexual violence, but also is like what nightlife is, right? That's socialization, interacting with other people. We are humans. We are programmed to interact and have connections and have friendships and relationships. So I think we're able to align that so much more now because we have had folks live through that social isolation that has been really harmful. So I think just simply those relationships, that community connectedness, I think moving forward, it's going to look a lot differently, this work. I think it's almost a little more accepted. I don't want to say it like that really, but really it seems like the cultural shift that we're all experiencing is carrying over into this work and just kind of leveraging that and making that work for us.
Thanks so much, Sarah. Those are some really great points. Michelle, I want to give you a chance to respond as well.
Yeah, just briefly, I think we've hit on a lot of these things already, but I think reimagining nightlife and also what sexual violence prevention looks in nightlife spaces to us just really means like authentic collaboration and partnership with, the stakeholders that we work with in the nightlife industry to develop these solutions and to work with them to identify the issues that are most important, that they, to create safer spaces. What do they think? So I think reimagining nightlife, we have to go to nightlife stakeholders to understand that and work with them collaboratively to make it happen.
That's great. Well, I really just thank all three of you again for being willing to share about the work that you've done and the way that you've approached this work. I think a big takeaway that I'm leaving with today is just this idea of, really thinking of nightlife as an asset in our communities and in the work that we're doing to prevent violence. Like, there is such an incredible aspect of connection when we think about these spaces. And so, I don't know, that's a little bit of a different frame, I think, than what we typically think of when we're doing this work. And I really love that and appreciate you all for lifting that up. And I think that will allow us to be more creative in our responses and our collaborations. So thank you all so much. I want to thank our audience. We have so many wonderful questions and just so much, sharing happening, and we couldn't do these web conferences without your participation. So we appreciate you all. This was recorded, and the recording usually takes us, within a week to get it up on our site. We will send an email out when you can access that. And again, we want to thank Eric for putting together that resource page that we'll include on the site here. So thank you all so much. Have a wonderful weekend. I don't ever get to say that. So have a wonderful weekend. Thank you, Tori, for all of your support. And thank you to our captioners at Aberdeen Captioning. This will conclude our web conference today. We'll see you all later. Thanks.